Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download some ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Cognitive deactivation. Thoughts and worries are for some authors the fundamental component of insomnia. The type of thoughts that impede sleep have been studied, and they are those that the person in bed does not sleep. The following types have been identified: daily problem solving, worrying about not falling asleep, house noises and other bedroom conditions, and general worries. The problem with thought control is that it is ironic or paradoxical, because there is a process of looking for alternative thoughts and a process of checking for success or failure, and this causes the thoughts to increase in frequency. When we want to not think about something, we think about something else and we get it, but suddenly we realize that we have achieved it and that we have not thought about it. So the thought is present again. It has been shown that wanting to stop thinking about something leads to an increase in the frequency of that thought. Consequently, the following techniques have been used to achieve cognitive deactivation. 1. Paradoxical intention. Giving the instruction to follow all the thoughts one is having without setting up any struggle to avoid them, even writing them down to materialize them and make them concrete. Of course, it has to be done out of bed. 2. Observation of the thought. That is, noticing what you're thinking and letting it go. Symbolically, you can imagine putting the thought in a jar or opening a door in your head to let it go. 3. Meditation. The techniques mentioned in the previous point are, in reality, forms of meditation that have as a result, not as a goal, to make the mind blank. In this sense, the use of a mantra or a cognitive task that requires a lot of attention and has no affective relevance, such as saying the alphabet backwards, can help to control thoughts. 4. Imagination, directed at a specific thought or image that is not arousing as a means of combating activating thoughts at the time of sleep. 5. Interrupting the stay in bed when not asleep also serves this purpose, although its primary mission is to associate the bed with sleep. 6. To get in the habit of making the day's plans in the morning, avoiding the bed being an element for planning that necessarily leaves things pending and undone. 7. To change thoughts that are exciting or distressing, you can watch TV or read, because in this way your attention is distracted. 8. Since there is an influence of daily worries that occur during waking hours, daily problems must be solved in order to promote restful sleep. Second, in order to establish automatism, we need to resort to classical conditioning so that the previous mechanisms are done automatically and without any effort. Here, we'll look at 3 points. A. Adapting sleep to a time of day. B. The bed as an element that triggers sleep. C. Adjusting the time spent in bed to the time spent asleep. Matching sleep to a time of day. 1. Do not take naps during the day. 2. Maintain regular schedules, both for getting up and going to bed. Get up and go to bed at the same time every day, regardless of whether you are sleepy or not. Trying to sleep too much one night or staying too long in bed can interfere with the automaticity needed to trigger sleep. 3. Establish a series of pre-sleep routines that activate the conditioning that automatically leads to the calm that is necessary for sleep. For example, lock the door, turn off the gas, brush your teeth, turn on the alarm, and do all those tasks that are necessary for that time of the night, always doing them in the same order. B. The bed as a sleep trigger. 1. Do not use the bed or the bedroom for any activity other than sleeping or sex. It is not advisable to read, watch TV, talk on the phone, argue with your partner, or eat in bed. 2. When you have got into bed, you should turn off the lights with the intention of falling asleep immediately. If you cannot fall asleep in a while, about 10 minutes, get up and go to another room. Engage in some quiet activity until you begin to feel drowsy, at which point return to the bedroom to sleep. 3. If you do not fall asleep within a short period of time, repeat the above sequence. Do this as many times as necessary during the night. Use the same procedure if you wake up in the middle of the night and are not able to fall asleep again after about 10 minutes. The moment you realize that you are awake or disturbed, get up and repeat this process. C. Adjust the time spent in bed to the time spent asleep. Last and very important would be to adjust the time in bed to the time asleep. The previous point is already an important step, but it is necessary to go further with sleep restriction, which consists of adjusting the amount of time spent in bed to the amount of time actually asleep, putting an end to the fallacy that the longer you stay in bed, the more you sleep. When the patient sleeps more than 90% of the time spent in bed during a week, he or she is allowed to increase the time spent in bed by a quarter of an hour, whereas if it is less than 80%, it is reduced by the same amount, up to a minimum of 4 hours. For example, if you sleep an average of 5 hours per night, per week out of the 8 or 9 hours spent in bed, you will start with a total of 5 hours in bed, from the time you go to bed until the time you get out of bed. If during 1 week the sleep efficiency is higher than 90%, in the example, if an average of 5.5 hour minutes sleep is achieved, the time in bed should be extended by 15 or 20 minutes, for example, by bringing forward the bedtime. On the other hand, if the efficiency is lower than 80%, in the example, if less than 4 hours of sleep, the time in bed will be shortened by 15 or 20 minutes. Periodic adjustments should be made until optimal sleep duration is reached. The total time the person spends in bed and how much of this time is spent asleep is assessed. The time spent in bed is then restricted to the actual hours of sleep, and the time spent in bed is progressively increased until optimal sleep duration is achieved. Initial and subsequent sleep efficiency can be estimated by dividing the total sleep time by the time spent in bed and multiplying this result by 100. In general, good efficiency is accepted as being above 85% and poor efficiency below 80%. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Treatment of Insomnia in Psychotherapy, Part 4. Remember, read the description of this video when you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.